I'm gonna put my glasses on. Good evening, everyone. Good evening. I hope everyone is doing well tonight for our Thursday Night Live. I'm sorry that it is giving you the wrong actual title for today, because it is definitely not communication and community resources. So let me see if I can get that changed. Create a banner. We're going to be continuing our conversation as we are discussing cardiovascular health. And let me make sure I get this going over here for our Facebook Live. We are discussing cardiovascular health, and we wanted to make sure that hopefully we can get this going live here in our Facebook group too. And let's see. They are saying unable to start a live video. Okay. Well, isn't that about nothing? But we're going to try this again. And what I'm going to do is go to my page and I'm going to share from my page and see if we can do it that way. You know, what can we do? What can we do? To friends, acquaintances. I hope we're gonna get this one day. We're gonna hopefully get this one day, and it's gonna come out just the way we want it. To a group. It says I can share it to a group. We're gonna do it to Dear Encourager. All right. Cardiovascular health. Cardiovascular. Now I can't spell, everybody, but yeah, today I'm excited because my mama, Mrs. Frankie Rosenthal, is going to be doing our discussion today, and yeah, so I hope everybody is ready, and hopefully somebody may ask a question or two. Let's see. We're getting it posted. It said it's shared to the group. All right, let's go. All right, Mama, we're ready for you today.
Hi, everybody. I'm glad to be with you all again. And Keisha's going to keep my time for me. Okay. So, because I can get kind of carried away sometimes on the subject that means a lot to me. Today, Vanessa started off last week on cardiovascular health, and she did a wonderful job giving an overview on some of the things that we were going to discuss. And she did an excellent job on some things that's not going to be included in this overview tonight. Tonight, I want to talk to you all about heart attacks. And I know we said we're talking about cardiovascular health, but unfortunately, the thing that happens sometimes is that when we are a little bit reluctant to do the things that we need to do to protect our health, then we get into some consequences for our own actions. And so when we're talking about prevention, we also have to talk about recognition of some problems that we need to work on when we see them. So basically, a heart attack or myocardial infarction occurs when the blood flow to the heart is severely reduced or blocked. And usually this is by plaques that form in the coronary arteries. And the plaques form usually because of deposits of those things that we like to eat, fatty deposits when we eat too much stuff that we're not supposed to eat. But the plaques can also be caused by sugar deposits if you're diabetic and the diabetes is uncontrolled. So basically, for whatever the reason the plaques are there, it cuts off the blood supply to the heart. And when this happens, you can sometimes get blood clots and blood clots rupture. And so therefore, again, the oxygen supply is cut off. Now, sometimes you can have plaques in your arteries and the heart still functions because the coronary artery is not completely blocked. And so, therefore, you can still get some blood that goes into the heart. Now you say blood going into the heart. Well, the heart circulates all of the blood all over the systems, but the heart is also a muscle, and the heart requires that it gets oxygen and food to it also. So that's why the coronary arteries come in. Now, there are two coronary arteries, one on the right, one on the left, and we're not going to get into which one does what, but just know that they're there for heart health. Okay. Now, the thing you have to be concerned about is that recognizing the signs of the heart attack. Now, everybody knows you've heard about the massive pressure on your chest. Feels like an elephant is sitting on your chest. And hope you never experience that sensation. Okay. But that's not what happens sometimes. And especially with us women, because women more than likely have atypical symptoms of heart attack. 1/3 of the women experience no chest pain at all. 71% get flu-like symptoms like some week or so or longer than that before they actually have a heart attack. It can come on the flu-like symptoms and just fatigue. Um, we can have hot or cold burning sensations or tenderness to the touch on our backs and our shoulders or our jaws, but no particular sharp pain. I remember years and years ago when my mother had a heart attack and she was complaining about back pain. And because she was complaining about back pain, then everybody kept saying there was nothing wrong with her heart. But if you watch the monitor, then you could see some variations in her EKG. And a doctor sat there with me and was watching the monitor, and he says, well, I don't know what this is, but there is something that's going on. And sure enough, she had a heart attack. But again, no one believed her because she didn't have that. I'm not having any pain in my chest. My back hurts, So she would have been a misdiagnosis. Then there are signs women complain of nausea, indigestion, shorted breath. And that's not to say that men can't complain of some of these same symptoms, but I was just trying to tell you how sometimes women don't get the typical symptoms. And then we have a tendency to minimize our symptoms. We say, oh, we'll be all right in a little bit, and don't necessarily think anything about our symptoms at all. But I was reading through a solicitation for donor from the American Heart Association this month. And it was talking about something called Heart Truth. And Heart Truth is a national awareness and prevention campaign about heart disease in women, and it's sponsored by the National Heart and Lung Institute. And what Heart Truth is, it's a resource, source of way we can. It's a source where we can obtain resources. Okay, to talk about more education, to get update information about heart issues, and to even do healthy recipes. And you can download the book, Healthy Heart Workbook for Women, and if you want some more information. But what Heart Truth did and does is that they started the Red Dress campaign. And the red dress campaign, it was designed for with the primary message of saying that heart disease doesn't care what you wear. It is the number one killer in women. And we just had the red dress day um, on February the 1st, So I just thought it was interesting that you knew we had the red dresses, but a lot of us didn't know why we were wearing red dresses. You just thought you just pick the color and say, oh, that's the color we do for heart health, okay? So I thought I'd just throw that out there to you so that you can now know why we do red dresses, for heart health. So other signs of heart attack, symptoms of heart attack can be have cold sweat, lightheadedness, or sudden dizziness. I can't talk tonight. Um, so if you have a pain in your chest and you haven't been having the pain in your chest and you're having some symptoms, then you need to go to the doctor. But and don't say, oh, it's indigestion. You can say indigestion, but if it stays there, if it radiates down your arm, up to your jaw, up to your neck, up to in your back, then you have to consider the fact that you're having a heart attack. And nobody wants to say that they're having a heart attack, but you have to consider it. Now, there is something called angina or angina, depending on how you want to pronounce it, that occurs when the heart, a partial supply of blood is cut off to the heart. And some of the symptoms might be still the same, but usually you go to the doctor and they can do the diagnosis and they can tell you that it is or is not a heart attack. And then they will give you usually some nitroglycerin so you can treat it. So that if you've had this problem and it comes on again, then your first thing would be to take your medicine, take your nitroglycerin. And if after 3 doses, usually it doesn't work, then you say, oh, this is a heart attack. So you want to call 911 or get somebody to take you to the emergency room for you to be checked out. Now, they also say you can, but they recommend that you can take aspirin, if you first starting to have the symptoms, but you need to make sure that the aspirin doesn't conflict with some of the medicines that you're taking. But if you're having a heart attack at that particular time, then I don't think you want to go through your mind, oh, is this aspirin going to cause me any difficulty? One aspirin probably wouldn't cause you too much problems, but that's something you have to know. That is something you can do if you think you're having a heart attack. You take an aspirin and call 911. Now, what lay people need to also learn is how to do CPR. Excuse me. And CPR for lay people is much more easy than it was before because all you're doing is chest compressions, So, but you need to know the right position to put your hand and all that. So you can take a layperson course in CPR. And I'm hearing that 911 people will talk you through it if you haven't had it, So learn that you might need to do CPR. Now, causes of coronary artery disease. Of course, we talked about sugar deposits. Then there's cholesterol deposits that can cause these plaques to form in your coronary arteries. Then there's also something called, you can get a spasm, that has nothing to do with your diet, but usually it's because of high levels of us eating improper foods and getting deposits in our coronary arteries. They're seeing a lot of effects. Some people with COVID now will end up be having heart attacks, because of some of the damage that's related to the COVID. And so just kind of know that, recognize the symptoms no matter what the causes it. Now, Vanessa talked about risk factors last week, but we're going to cover them again Age is one thing. Um, Men age 40 and older and women age 55 and older are more likely to have a heart attack than are younger men and women. Now, it used to be that men had heart attacks more often than women, but I'm not sure that's the norm anymore, because when women start smoking um, more, then it kind of increased the risk for women to have more heart attacks, or as equal heart attacks as men, because tobacco use is a risk factor, and so is secondhand smoke from other people who are smoking. High blood pressure, one of those things that we like to say, "Oh, I just got a little blood pressure, high blood pressure." So you may or may not take your medicine, but over a period of time, high blood pressure can damage your arteries that lead to the heart. And so when you combine high blood pressure with some of the other risk factors like obesity and the high cholesterol and the diabetes, then it increases your risk even more for having a heart attack. Talked about high cholesterol or triglycerides, and you want to make sure that you fix your diet where you have more of your less, that your cholesterol level doesn't go over 200 for your triglycerides, and that you have more of your HDL, high density lipids, because you hear HDL, LDL, one low, one high, but the object is to have less of the lower LDH and to have more of the HDL, or within the limits for the HDL, not more, but the adequate level, and less of the other ones. You do need to have these lipoproteins, or that's what they are, because it does other things in your body, but you have to watch the amount that you have, and all of that can sometimes be controlled with just diet alone, watching what we eat. Other risk factors, talked about diabetes and the sugar deposits. Now, there is the trifecta when you put three of these factors together, like obesity, high blood pressure, high cholesterol, or high blood sugar, then that will increase your risk even more so, because it's called what they call metabolic syndrome. So that will increase your chances of having a heart attack. Family history. You can't change your family history. Vanessa talked about that last week. You're born into a family, and when you come into a family, if they have a propensity for um, certain illnesses, or have had certain illnesses, or had heart attacks, then your risk for heart attacks will be increased. Not enough exercise for everything, you all, is always exercise. We need to exercise. We need to walk. Um, we need to walk. We need to watch our diets. And if you notice, for any illness nowadays, that's what they tell us. And what do we do? Do we exercise anymore? No. Do we watch our diets any more than we have been? No. So the thing for us to do is to bite the bullet, walk at least 3 times a week. It has so many hours. Some tell you hours a week, some 5 days a week. Some people might need more than that for your walking. Watch your diet, cut down in the amount of sodium that you eat also, because that causes high blood pressure. And then, of course, of all of the cholesterol that's in your diet. Watch food that you, all the fried foods. Watch all of those things. Um, and sweets. Watch the amount of sweets that we eat. Because again, because of the deposits of the sugar. Stress. Try to reduce your stress, because I do a lot of stress eating.
Me too.
Stress eating, boredom eating, oh, let me go eat this. And then when I find myself, I say, girl, why did you eat all of that? So you have to watch stress. Stress also affects you, because it clicks in a lot of extra sugar, when we are under a whole lot of stress. Um, a lot of young people nowadays are having heart attacks, and has a lot to do with illegal drug use. So some of the younger people, um, a lot of young people are having heart attacks related to illegal drug use. And if you had high blood pressure when you're pregnant, then chances are you're going to have high blood pressure when you're not pregnant. And if you have some autoimmune conditions, then it will affect you. Um, Irregular heart rhythms, okay, is also a factor. Um, uh, uh, I'm sorry, not a factor. We're getting to complications now. Okay. I want to say something about obesity, though, before we leave. Um, when people look at folks and they say, oh, um, just because you're obese doesn't mean you're not going to have a heart attack. I talked about you got to have some other problems or conditions going on that will help you. But you say, well, with obesity, you assume that they eat a whole lot of stuff and they eat a lot of improper things, and maybe. But you'd be surprised at what the terminology is for being obese, you all. Um, it's not what you think it's not what it has been, because according to my BMI, then I am considered obese. Okay. And your BMI is how they measure the body fat. And it's you measure on the basis of your height and on the basis of your height and your weight. And they do some figuring, but there's a little cheat scale out there right now that you can just go and look at online, and you can look at and figure out your own BMI on the basis of your weight and your height. The normal BMI should be 18.5 to 24.5. If you're overweight, it's 25 to 29.9. If you're obese, it's over 30, and they're classified as class 1, class 2, class 3. I'm not going to tell you what class I'm in. And the thing is that if we reduce our weight by 5 to 10% or more, then of course it increases your heart benefits. Okay, heart health benefits. But if you decrease it just by 3 to 5%, so if you weigh 200 pounds and you decrease it by 6 pounds, 10 pounds, then that will help with your heart health. According to the norm, I'm supposed to weigh, to be in that normal BMI, I'm supposed to weigh 149. I'm not going to tell you how much I weigh, okay? But I promise you it's not 149, okay? So, and for me to get back to just being overweight, then that's a lot of distance between where I am in my weight and that. So, but we need to work on it. I remember when I was on a program where we decreased the salt intake, was a program sponsored in the area. Then I lost weight. I did drop my weight down to about 12 pounds, and actually it felt a whole lot better, but we were reducing the sodium, intake, and watching the food that we're eating. And it really did help. So it's always a benefit to drop your weight, to lose some weight if you possibly can. Okay. Mm-hmm. The end result is, if you do not do what we're supposed to do and we end up with a heart attack, then the complications could be you end up with a irregular heart rate that's going to carry on with you due to your heart damage. Because once you have a heart attack, then the heart muscle is damaged, then it does not regenerate. So that becomes scar tissue. So the heart functions in spite of, usually, depending on what the arrhythmia is. So, but it does decrease the functioning of your heart. You can go into heart failure. You can go into cardiac arrest, and your heart stops beating altogether. Okay, and hopefully can be revived. And some people don't recover from the cardiac arrest. So our thing on prevention. So what we're gonna do to prevent um, heart heart attack? Well, we're not gonna smoke or use illicit drugs. We're gonna maintain a healthy weight. Okay. We're going to watch the food that we eat. Stay away from all these fast foods and fried foods and candies. No one said you can't have some, but we're going to learn to be use moderation and below moderation if need be. And if you're on medications, you're going to take your medicines like you're supposed to. And if we do some of these things, we try to do all of those things, then we can reduce our risk of having a heart attack, and hopefully be here with your loved ones, um, much longer. Okay.
Yes.
So nobody said it was easy, but I see exercise, 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 and that can just be walking. Okay. Walking. The less you do, the less you want to do. If you sit in the chair all day, every day, then all you want to do is what? Sit in the chair every day. Okay. So we're going to work on exercise. So that is the end of my presentation.
And it was wonderful.
And are there any questions?
Let's see if we have anybody. Oh, I wanted Jaden pointed out in reference to the new CPR guidelines. You know how they used to say use "Staying Alive" as the song to do the compressions for you younger people. Now they say you can use Kendrick Lamar's "Not Like Us."
I
wonder what. Okay. So
whatever works.
Whatever works for you to keep somebody alive. You can, if you want to use Kendrick Lamar, "Not Like Us," put that in your mind.
Use the beat to Kendrick Love, "Not Like Us."
Okay. There you go. All right. So just make sure you keep whoever around you who needs CPR alive until you call 911. Okay, wait a minute. Look, I got a comment. Let me see if that's a comment. Let me see. Okay. Sounds like good advice is what we got from Kendrick Frazier. Thank you so very much for your comment. So yeah, everybody that is it, but really it's a good idea to try to look into CPR because you never know when someone around you is going to drop and need some CPR from you. And now all you gotta do is compressions. You don't have to do mouth to mouth. So be it Stay Alive, Kendrick Lamar,
and throw some choking in there with it in your CPR. But we're talking about heart right now.
Yeah, do some Heimlichs.
Because I remember years ago when I choked and I was depending on. I was at one of my relatives' homes, and I was telling her I was choking, and she was going, "What? I don't know what to do. What?" And I was trying to say press, do the compressions and whatever else it was, and of course I had to end up finding me a chair and do it for myself. But anyway, and I told her that one of my thoughts was going to be that I learned CPR and I could help save somebody else, but then I didn't have died because nobody was
there to save you. Ain't me.
So please, you all, now that because even the chest compressions will help with choking, but that's not what that's not the acceptable thing for choking. I just brought it up, okay?
Mm-hmm.
But do take advantage of CPR, and they'll teach you how to use the AED if you're around one, and you'll know how to do help save a life. Okay.
Yes. Yes. So just make sure you do some CPR for a little while and then get somebody to go call 911. All right, you can
Do
save a life.
CPR if you're by yourself. Do it by yourself for at least 2 minutes, and then run down a pick up the phone and dial 911, and then do it some more. Kind of
Yeah.
stuff. But get the circulation going. If you're the only person there and nobody else is going to be there, then you have to pause for a moment to dial 911. Okay.
Oh, and while we're on here, let me tell you, Kendrick Rosenthal is running a marathon. He's running in the I think it's called the Peachtree Atlanta Marathon. No, Publix Marathon. And he is actually running for Dear Encourager, and it's a fundraiser for us. So we're going to be posting information related to how you can donate to help us in our fundraiser and support my brother and our board member as he is training and preparing to go and actually do this actual run. But just know that also you can go to dearencourager.org and you can donate on there also, because we want to continue to be able to bring this type of education to you all. And we're just thankful to be able to serve you all. And please share this actual what is this called? Share our Thursday night chats with others so we can actually serve more people, because this is what we're here to do, and we're really thankful to be able to do it. Okay. Thank you so much for joining in. If you have any questions or comments, we do check and we'll answer as needed. And thank you again. And I'm so excited that Mrs. Frankie Rosenthal got on here today, and she brought this education to us. And she's my mommy, and I'm so proud. And I thank you so much for doing this tonight.
Good night.
Good night. Bye.
Bye.